That day's routine was just 30 minutes of exercises in the home. I was feeling fatigued, so I thought, well, let it pass. And as soon as I laid down, I felt this pressure on my chest. But I couldn't bring myself to call 911. I thought, this could be something significant. So I called my wife.
He said, I think I'm having a heart attack. And I said, can you call 911? So I had him on my speakerphone.
So she was like, quick, use your phone to call, and I'm gonna keep him on the phone in the car so that we have contact with him. And then you could just hear the phone like fall on the other end. And I'd never dialed a number faster in my life.
My doctors later told me, I had what was called a widowmaker. The vessel feeding my left ventricle was 100% blocked. So, that was the day I probably should have, passed away.
Tim Gallagher's heart suffered massive damage, and with his condition deteriorating rapidly, Tim's spouse asked about a heart transplant for her husband. Transplant is not customary for most heart attack victims, and this hospital preferred a different plan, telling her the wait for a new heart could take months. At that point, Terry Gallagher followed one of the American Heart Association's most important recommendations in times of doubt.
I said, this is just too important. I've got to get a second opinion. Can you please help me? Baylor agreed to take Tim, and we had him moved down there that night.
We did a very rapid evaluation, and we knew the heart was no good, and we knew that ultimately transplant is what we needed. So our job was to keep the rest of his body in good enough shape so that he could get a transplant eventually.
You don't know when you're going to get that phone call from the next physician saying, get down here, we have got to do another surgery to keep him alive.
Placed on a temporary support device called an ECMO, Tim Gallagher was as close to death as he could be because a machine was now doing the work for his heart. He was placed on the transplant list, status 1A, meaning he likely could not have survived more than a week without a transplant.
He was put on the transplant list at 5:45 on the 20th of December. On December 21st, we got a telephone call at 2 o'clock in the afternoon that they had a donor. And that's less than 24 hours. That was an amazing day.
My odds of survival were probably less than winning the lottery. 2,000 receiving a transplant annually, and I got one of those. Statistically, I think I'm a miracle. I think I got the best treatment possible. Today, the Baylor Transplant Institute is having their annual transplant reunion. We have the opportunity to sponsor the event. My family created an online community called One Hearts, Two Lives. Our end goal is to elevate heart health awareness, to make sure that people take prevention of heart disease seriously. Well, we're both lucky men. We got a second chance. Now we got to do something with it. Myself and both of my brothers have had either bypass. My next oldest brother had a quintuple bypass, so it's certainly in my family tree.
This is a partnership. I can't help you by prescribing you something if you don't take it. But it's also our job to explain why we're prescribing it, what the expectations are if you take the medicine, and what are the expectations or risks that you're taking if you don't take the medicine.
The second opinion was the difference between suffering for 11 to 12 months with an extra piece of hardware inside me, or suffering for less than 20 days and having a new heart pumping inside me.
If prevention is about awareness and seeking alternate opinions is about knowledge, surviving a heart attack requires immediate specific action. The American Heart Association has a simple plan. Life-saving treatment begins with calling 911. The campaign's sobering slogan, "Don't die of doubt."
They always say, don't wait, don't drive that person to the hospital, and it is absolutely true. I mean, we really live in an amazing place to be so close to wonderful doctors who really care and show how much they care about their patients. Baylor is incredible. I can't express my gratitude towards them.
Success stories like Tim's make it all worth it. The fact that a heart came along, a perfect heart came along for him at that time, when we really start to get concerned about complication, it's really nothing short of a miracle.
To be on the edge and be able to step back from the edge when you know there's certain death in one direction and there's life in another. You know, every day is a brand new day to give something back, make something good happen for others. Every day is a day I didn't have.